Hi, David here at Reform Physical Therapy and Pilates in downtown Cleveland. It is Therapeutic Thursday, and this week we were talking about low back pain and its relationship to core muscle weakness or trunk muscle weakness, or even in the hips. So I just wanted to go through a few quick tests I do as a physical therapist to check for muscle activity, muscle coordination, and muscle strength. Muscles that are really important to keeping the back healthy. So it's going to really be the posterior hip muscles or your gluteal muscles. It's going to be your multifidus muscle and your deep ab muscles. Okay, so those are the ones I'm going to be working on. Multifidus being a muscle that's very important in the low back and the extensor side of the back. So first one I'm going to do is a bridge test. And I'm going to try and do these myself and talk to you. So I am on my back. I will first have my patient with their knees together, squeeze and push their butt in the air. I want to know, where are they feeling the effort? If they're feeling it here, that is a red flag for me that they're overusing their low back muscles. I want them to feel the effort more in the rear end and the hamstrings and not in the back. If they look like this with an extra arch, I know they're using their low back. And sometimes they'll tell me they feel it the most in their quad muscles. I know they're not using the muscles I want. If that goes okay, I'll also have them do a one-leg test, and I'll look for whether their hips drop one way or the other, or if they lose height, or if they're shaking around, looks like they're not very coordinated. So that's one test. A second test that we'll use is a fairly challenging abdominal control test. I'll be on my back. I will typically take my hand, put it behind their low back, and I will tell them to push into my hand with their low back and to keep it there as they lift their legs. And a lot of times I'll see them arch way away like that, and that tells me that they're having a really difficult time using their abdominals to control their low back position. So that is two tests. The last test I will do would typically be on someone's stomach. And I will just see what it looks like from their back to do a little leg lift up, like that. A lot of times if they have uncoordinated muscles along their back and in their deep abs, I will see them collapse into a big arch in their low back, when where I want it to stay nice and quiet and flat, they will fall into a big arch. And that is another sign to me that their abdominals and their deep multifidus or low back muscles are not working together to provide stability for their spine. So if you have low back pain and you've been dealing with it and it's really giving you the blues, come down and see us at Reform and we will help you feel better. Thank you.